Hello, my name is Gerardo Gonzalez, and today I want to be discussing with you what is hypertension, also known as high blood pressure. High blood pressure is also known as the silent killer, and you are about to find out, the reasons why this is known as a silent killer. High blood pressure is a common condition in which long-term force of the blood against your artery walls is high enough that it may eventually cause health problems such as heart disease, which is the most common condition caused by high blood pressure. It is generally develops over many years and it affects nearly everyone eventually. Fortunately, high blood pressure can be easily detected, and once you have had high blood pressure, you can work with your doctor to be able to control it. There are two stages of high blood pressure, but before we go into those stages, I would like to discuss to you with you what is the top number and the bottom number. The top number of your blood pressure is known as your systolic, and your normal blood pressure normally would be systolic blood pressure of less than 120. Diastolic is a bottom number, and that should be less than 180. There are two stages of hypertension. The first stage is your blood pressure ranging from 140 to 159 over 90 through 99. The stage 2 hypertension, which is the last stage there is greater than 160 systolic blood pressure over greater than or equal to 100 diastolic blood pressure. Symptoms associated with high blood pressure is that most people with high blood pressure have no signs or symptoms. That is why it's called silent. Even if blood pressure readings reach dangerously high levels. A few people with high blood pressure may have the following symptoms, which are the most common ones associated with high blood pressure, which are headaches, shortness of breath or nosebleeds, nausea and vomiting, vision changes, and or confusion. Some of the causes of high blood pressure there are two types. And the first one is the primary hypertension, which is also known as essential hypertension. For most adults, there's no identifiable cause of the high blood pressure. This type of high blood pressure tends to develop gradually over many years. Secondary hypertension, some people develop this type of blood pressure is caused by an underlying condition. This type of high blood pressure tends to appear suddenly and may cause higher blood pressure than does primary hypertension. Other causes associated with high blood pressure are various conditions and medications can lead to secondary hypertension. Obstructive sleep apnea is another condition also known to cause high blood pressure. Kidney problems, adrenal gland problems, thyroid problems, congenital defects in blood vessels, illegal drugs such as cocaine and amphetamines, alcohol use or chronic alcohol use, certain medication, birth control pills, cold remedies, decongestants, over-the-counter pain relievers. We must be very careful with what we do take over-the-counter because some of these medications can be considered nephrotoxic medications which will affect your kidneys or are excreted through your kidneys. Risk factors associated with high blood pressure are age, race, family history, which is the very most common one, being overweight or obese, sedentary lifestyle, using tobacco or smoking, too much sodium or salt in your diet, too little potassium in your diet, too little vitamin D in your diet, drinking too much alcohol, stress, and certain chronic conditions. Complications that are associated with high blood pressure are heart attack or stroke, aneurysms, heart failure, weakened or narrow blood vessels in your kidneys, thickened or narrowed or torn blood vessels in your eyes, metabolic syndrome, as well as trouble with memory or understanding. Some of the medications used for high blood pressure are known as thiazide diuretics, beta blockers, angiotensin converting enzymes inhibitors, which are also known as ACE inhibitors, angiotensin II receptor blockers, which are also known as the ARBs, and calcium channel blockers, as well as renin inhibitors. Lifestyle changes that can occur with high blood pressure are to, number one, to eat healthy foods, decrease the salt in your diet, maintain a healthy weight, increase your physical activity, limit alcohol, don't smoke, manage stress appropriately, practice relaxation or slow, deep breathing, as well as the most easiest one is to monitor your blood pressure at home. And this is my blood pressure monitor that I use at home to monitor blood pressure. So I highly encourage every one of you that to check yourself and maintain a lifestyle that's healthy for your life. Thank you.